Birth Story 7. The Mom Who Saw Double. Mom. During her pregnancy with identical twins, she desired an all-natural childbirth. She developed preeclampsia, achieved childbirth via C-section. Baby number 1 and number 2, Manuel and Miller, born on December 12th, 5 pounds 4 ounces and 5 pounds 12 ounces. Gestation 37 weeks, 0 days. Labor. Her labor was induced with Cervidil and Pitocin, AROM for baby A. Induction failed to progress her into active labor. Dear Manuel and Miller, your original guest date was January 2nd, but you might grow up to be engineers with an actual birth date of 12/12/12, shared with your twin, no less. It was a cold morning on December 10th, and your mom went to her regular 37-week appointment, where she had routinely been seeing her favorite doctor. Your mom was carrying a lot of fluid around Miller, baby B, as they called you. And her blood pressure was being carefully monitored for running high. Your mom called me around 12:30 p.m. and said that she and your dad were unexpectedly headed to the hospital for an induction due to her worsening preeclampsia. Your mom's pregnancy was quite the surprise for both of your parents. They learned of their unplanned pregnancy the day before your mom left for an international trip. She would be gone for a month. Your mom was leading a group of students across Costa Rica, so she hugged your dad and got on the plane. While in Costa Rica, she utilized their free healthcare system and made an appointment with a local OBGYN after she spent many days throwing up and dehydrated. At this visit, your mom heard the provider announce the even greater surprise that the egg had split, creating identical twins. This happens in just 0.45% of pregnancies. She called your dad on an old payphone to let him know the news. She said the other line was silent for a long while, and then pure excitement erupted for both of them. From this day, your parents planned for an all-natural, unmedicated vaginal birth, but they agreed that they would stay loosely bound to that idea because they knew that complications were more likely to arise carrying monochorionic diamniotic twins. That meant you were sharing the same placenta, but had separate sacs, creating a risk for twin-to-twin transfusion syndrome. As well, your mom's doctor let her know that the position of Miller's, baby B, head would also determine if a C-section would be recommended. So, when the induction was recommended, they were fully open to a change in their birth vision. The induction began at 5 p.m. on December 10th with the insertion of Cervidil vaginally. Pop out prostaglandin inductions. Cytotec and Cervidil are two commonly used synthetic prostaglandins that are the first line of inductions if your cervix is thick and closed. Cervidil is administered vaginally, while Cytotec may be administered vaginally, rectally, or orally. Before scheduling your induction, your provider will perform an internal vaginal exam and will give you a Bishop score. You may hear your provider say favorable or unfavorable cervix, rather than a number based on your score. if your Bishop score is unfavorable, your induction will likely start with one of these two drugs. Both are used to ripen or soften the cervix, helping it to thin and dilate before moving on to the next phase of an induction. Sometimes prostaglandin inductions are all that is needed to help you jumpstart your labor. Your mom's blood pressure was stable at 142/85. Contractions were erratic at 2 to 7 minutes apart on the monitor, and your mom did not feel them. She had a very special plan for you boys. She wanted very few medical interventions and hoped for a vaginal delivery. The providers were very respectful of your parents' birth wishes. I met your parents at the hospital and was able to talk to the doctor about the induction. The night of the 10th, you boys and your mom handled the Cervidil well. Your mom didn't get much sleep as she was filled with excitement, but she rested. Your mom's contractions were 1 to 4 minutes apart all night long on the monitors, but they were not adequate to produce cervical change, and your mom did not feel them. At 6:30 a.m. on the 11th, they moved your mom to her birthing suite. She was able to shower and eat a good breakfast. The doctor checked her cervix, and it was 1 to 2 centimeters dilated and thick. So, not effaced yet, unfavorable. Her cervix was high and tucked up behind Manuel, or baby A, as they called you. They began the Pitocin induction at 7:30 a.m. They started at the low dose of 2 and steadily increased to 24 throughout the day. You boys were moving all around and super active. It was very hard for the nurses to find you on the monitors. I was able to create a spa-like environment with lighting and essential oils, and I massaged your mom's hands and feet while she rested her eyes. Your mom was in amazing spirits, barely feeling the mild contractions that were still 1 to 4 minutes apart. We chatted and just hung out, hopeful for active labor to begin. The doctor checks your mom's cervix again at 2:30 p.m., and she was still 2 centimeters dilated. The Pitocin had continuously been turned up, and contractions were consistent on the monitor. Your mom said she could feel something sometimes, but not really. Your parents decided with the doctor to break Manuel's water to try and move things along. At 5:45 p.m., your mom progressed to 3 centimeters dilated, 70% effaced. Miller, you had a separate amniotic sac, and it was still intact. Your mom's blood pressure was under control still at 120/80, right after the first water was broken, and her providers were comfortable that her preeclampsia was controlled. At the 7 p.m. shift change, your new nurse sat on the side of your mom's bed, holding the monitors for hours. She wanted to make sure you boys were continuously monitored, and your parents appreciated how dedicated she was. Her medical team allowed your mom to get up and go to the bathroom and move around for a few minutes each hour. Some of your aunties came by to say hello. Your mom was still not feeling her contractions at 11:15 p.m. It had now been 30 hours since the induction was started and 5.5 hours since the water was broken, with no strengthening of the contractions. The doctor came in to check your mom's cervix again. She hadn't made any change at all since the last check, still 3 centimeters and 70% effaced. I left the room to give space for your parents to talk. They asked me to come back about 15 minutes later. When I came back, your parents decided to stick to their original plan, which was not forcing their own agenda for a vaginal birth and induction too far. They wanted a natural childbirth, but they were open to whatever birth was needed. Your parents and the doctor elected to stop the induction and to transfer your mom to the operating room, OR, for a cesarean section. There was no emergency, and everyone was calm and accepting of the pivot in the birth plan. They brought scrubs for your dad and me to put on. Your mom was given an antacid to settle her stomach that she said tasted awful. And they wheeled her away at 11:45 p.m. to the surgery room. Your dad and I waited outside in scrubs until just after midnight, when we were both welcomed inside. Your dad sat down next to your mom's head behind the sterile curtain, which protects the sterile field where the surgery is being performed, and held her hand. I stood up behind your dad and had a clear view of the entire surgery. The anesthesiologist had your mom awake and numb with a spinal anesthesia block, which is different than an epidural. Then the pressure was on the clock. It was now December 12th, 2012, and everyone speculated they would have Manuel out by 12:12 a.m. Well, it took a little longer. Manuel, you were born first at 12:18 a.m. The cord was wrapped around your neck twice, but the surgeon quickly unwrapped you at delivery and cut your cord. You were so cute and were taken to the warmer while they delivered your brother. Your mom said that she only felt pressure and she felt wet where the amniotic fluid ruptured. Miller, they broke your water just after Manuel was born, and several liters of fluid gushed all over your mom and all over the floor. We were all standing in it. This was the first time your mom was diagnosed with polyhydramnios, excessive amniotic fluid. Somehow you were delivered in the same minute as your brother at 12:18 a.m. Your dad had the camera ready and was taking pictures and talking to you boys immediately. We could see that you had red hair and you were mirror images of each other. You both stayed in the warmers for your newborn checks. Pop out, newborn checks and procedures. Immediately after your baby is born and you are bonding skin to skin, a nurse is assigned to assess your baby and to provide an APGAR score at minute 1 and 5 after birth. You may notice they take a vial of cord blood to test, prick your newborn's foot to test their blood sugar, perform a hearing test, weigh and measure your baby, count their fingers and toes, examine their organs by external touch, and check reflexes and hip rotation. Your newborn will then be tested for up to 60 or more conditions within the next 48 hours, varying by country and state. They will also need your consent or refusal for antibiotic eye ointment, vitamin K injection, and their first dose of the hepatitis B vaccine. Unlock more about these newborn checks and procedures and what to include in the newborn section of your birth plan at birthstory.com. Your mom felt good and was crying tears of joy as she heard your first noises. They weighed both of you right then, and Manuel, you weighed 5 pounds, 4 ounces. Miller, you weighed 5 pounds and 12 ounces. Minutes after your birth, They brought you both back with your mom and dad to a recovery room. You were both able to lay on your mom's chest, skin to skin. Miller, you were making some funny sounds and having trouble breathing. The NICU nurse kept suctioning the amniotic fluid out of your mouth and nose. She said you must have swallowed some. Minutes turned into hours, which turned into a lot of checks and tests. Your parents soon learned all of your noises while breathing in excess amniotic fluid helped indicate you had a tracheoesophageal fistula, meaning there was an abnormal connection between your esophagus and your trachea that would require surgery immediately. You were taken to the NICU for surgery and recovery and had to stay in the hospital. Your mom still chokes up when she thinks back on this time. She nursed your brother and brought you breast milk in the NICU when she visited you each day. Manuel stayed with your mom and dad and got to go home with them a few days later. You were eventually reunited with your family at home just before their Christmas holiday. Much love, your doula, Heidi. To hear this mom's full birth story, listen to episode 5 on my Birth Story podcast.